Hi everyone, welcome to today's Lunch and Learn. Today we have Dr. Jennifer Cooper presenting on compassion fatigue, so I will turn it over to her. Thank you for joining us.
Thank you. Well, welcome. I just wanted to start with with my contact information. So if you have any questions later or you want some more information about anything, you're always welcome to call me or email me. My email is just my name, so it's Jennifer, the letter K, which is why it's bolded, cooper@gmail.com. So feel free to reach out after this presentation if you do have questions that maybe come up later. So we are talking about compassion fatigue. So I just want to start with kind of a little bit of self-reflection. So are you feeling any of these things? Maybe irritation or uncertainty, helplessness, lack of motivation, feeling tired or overwhelmed, sad, depressed, maybe you're having some trouble sleeping or trouble concentrating. And you look at that list and you're like, well, who isn't feeling that right now? Like everything is so uncertain and so up in the air and things are changing all the time. I mean, how many of you would have guessed a year ago you'd be watching a presentation with somebody wearing a mask? It's just, we're in these very unusual times. And as, frontline healthcare workers, there is even a higher risk of that. And so all of this describes what's called compassion fatigue. Compassion fatigue is this combination of physical, emotional, and spiritual depletion that occurs when you're caring for patients that are in significant pain or in physical distress. And it's more than just burnout. It has these unique aspects of it, and we're going to compare it to burnout in just a little bit. But the thing is, with compassion fatigue, rest is the answer, but it also, you need more than you assume you do. So you can take a long weekend and just do nothing and relax, kick back, but it's not enough. At the end of the long weekend, you're still feeling like, I just don't know if I can go back. And so it just, you never quite feel fully rested when you're in the middle of it. I found some quotes. This one is from an article by Pfeiffering and Guiley. And they said, those who have experienced compassion fatigue describe it as being sucked into a vortex that pulls them slowly downward. They have no idea how to stop the downward spiral. So they do what they've done since medical school. This was a study on physicians. They work harder and they continue to give to others until they're completely tapped out. So it's, that you're getting depleted, but you don't know what else to do, so you just keep working harder and harder and harder and harder until you're just completely out. Charles Figley is one of the first researchers who wrote about compassion fatigue, and he described it as a dark cloud that hangs over your head, goes wherever you go, and invades your thoughts. So let's look at some definitions. First, I want to talk about the difference between primary traumatic stress and secondary traumatic stress. Primary traumatic stress are things like acute stress, post-traumatic stress disorder. They are from an extreme event that you either witnessed or you were a part of. It happened to you or you saw it happen to someone else, and it results in a traumatic response. Okay, so that's primary traumatic stress. And folks that have compassion fatigue can have primary traumatic stress, but typically it results from what's called secondary traumatic stress, or sometimes we call it vicarious victimization or traumatization. So it's this phenomenon where you become traumatized, not necessarily from the event itself, but from helping those who went through the event. And so it's hearing about traumatic events again and again and again and again. And so this is where, we come back to our definition that, and this one is from a different researcher. It takes it a slightly different take. It's the emotional residue or strain of exposure to those suffering the consequences of traumatic events. It can also be called empathy overload, that you just have nothing left to give. So folks that are struggling with this feel like they've just run out of care. They just can't hear another story. They can't do another thing with someone who is in a state of trauma. It can coexist with burnout. In fact, some of the researchers described it as a type of burnout. So burnout is this cumulative process that's marked by emotional exhaustion and withdrawal and associated with increased workload and institutional stress. It's not trauma related. So you can have burnout without an ounce of trauma. It just has to do with running out of resources. And I found this graphic that I thought was useful. So if you are burned out already, you're just, you have too much on your plate, you're doing all these things that somehow have lost their meaning because it's just too much, you're not taking enough time for yourself. Add that with the secondary trauma, and you're likely to get compassion fatigue. Compassion fatigue does have a more rapid onset than burnout. Burnout tends to be this kind of long-term, growing, gradual process, where compassion fatigue can happen even with one instance, where it can just be so overwhelming that your system will just kind of shut down. But the good news is that because of that rapid onset, it also, if you address it quickly enough, you can make a change and it can be turned around very quickly. Okay? So the first step in facing this is recognizing whether or not you are in a state of compassion fatigue. And so I found some of these warning signs, and there's a lot of them. And some of them look like burnout, because once again, burnout is associated with this. And some of them look like depression, some of them look like anxiety. So I'm not going to read the whole list to you, but you can see abusing drugs and alcohol or food, so you kind of fall into addiction. Blaming, diminished sense of personal accomplishment, just feels like you're not getting very much done. Hopelessness, inability to maintain balance of empathy or objectivity. So you just, somebody comes in and they tell you something horrible, and you're like, yeah, I just don't feel anything for that person. Whereas before, your heart would break for them. Low self-esteem, sleep disturbance, workaholism. Not being able to accomplish as much because you're working all the time. People who are most at risk, those who are new to the field of caregiving of any kind, simply because they don't recognize the signs. They don't recognize the inherent stressors because they're new to it. And there's more stress when you're new. You're already kind of dealing with your own sense of, oh my gosh, what am I doing? And, am I just faking this? And then you add in all these other things, and it's easy to get overwhelmed. Those with a history of personal trauma, having an ACE score. ACEs is a trauma study that looked at certain instances that can happen in childhood. That if you have, the more of these types of events that you have in your life, the more likely you have mental illness, substance abuse, all these other myriad issues to deal with. And so the higher your ACE score, the more likely you also will have a likelihood for compassion fatigue. It also includes current things. So if you have a family member who has just passed away, or you're dealing with a divorce, those aren't childhood traumas, but they do affect compassion fatigue. The number of clients you interact with, the higher the number of people you interact with on a daily basis, the more likely it is that you have that you develop compassion fatigue. So if you're working in a really high-paced environment, like an emergency room, where you're seeing a high number of folks every day, you're more likely to experience this. If you've already had a history of burnout, once again, if you have trouble communicating, so if you struggle to express your emotions, maybe you bottle things up inside, that also can result in you exploding and just kind of shutting down. And then finally, those who don't have a personal support system. You don't have a safe space to express your emotions, talk about what's going on in your life, that sets you up for compassion fatigue. So COVID-19 obviously sets all of us up for a lot of these things. We have isolation. We're not, you're not allowed to do the things that you normally would do. Going out, for a night with your friends to de-stress isn't an option right now. And then add to that fear of getting sick, fear of exposing your family or your loved ones to the virus, and then combine that with these ever-changing requirements. Things, especially in the beginning, where they really were kind of scrambling about what to do and what policies to set, and there was a lot of uncertainty. And here it is now. We've been doing this for months, and we still don't know what next month is going to look like. And so those things all combine to make all of us more at risk for this. I found two studies that I just wanted to talk about. They are both conducted in Wuhan, China, with healthcare workers. The first one looked at symptoms of workers in a specific hospital in Wuhan, China. And they found that 50% reported symptoms of anxiety, 44% reported symptoms, 50% reported symptoms of depression, 44% reported symptoms of anxiety, 34% reported insomnia, and 71% reported just overall distress. And they found that nurses, women, frontline healthcare workers, and those specifically working in this hospital, tended to be more likely to report significant symptoms, okay, rather compared to other healthcare workers. And then the second study looked at the symptoms and clustered them into groups. And so they found three clusters. One was breathing and sleeping disturbances. The second was gastrointestinal complaints and pain, so things like nausea and headache. And then cluster C was general symptoms, so fatigue, chest discomfort, heart palpitations, things like that. And the occurrence was caused by environmental and personal stress disturbance. These were not, they didn't have an etiology of biological cause. It was stress-related symptoms. So if you have concerns like, okay, this is starting to sound maybe a little uncomfortable, like maybe this is hitting a little too close to home, we're going to do a self-assessment in your handouts, and also I'll go over this in the resources at the very end. There's a longer assessment that you can take, but just for the sake of time, we're going to do this quick one. So, personal concerns commonly intrude on my professional role, yes or no? My colleagues seem to lack understanding, yes or no? I can find even small changes enormously draining, yes or no? I can't seem to recover quickly after association with trauma. Association with trauma affects me very deeply. My patient's stress affects me very deeply. I've lost my sense of hopelessness or hopefulness. I feel vulnerable all the time. I feel overwhelmed by unfinished personal business. So you only need 4 of those on this self-assessment to qualify for compassion fatigue. Okay. So if that's the case, I would suggest go through that handout, and I'll go over it with you when we get to the end. But it's the compassion satisfaction and compassion fatigue questionnaire, and it will look a little bit more in depth at what exactly is happening with you. So let's talk solutions. I want to introduce something called compassion satisfaction. Compassion satisfaction is the joy of your work. It's in being able to do your work well and the pleasure you derive from it. And so here we have the first graphic that we showed, where burnout along with secondary trauma results in compassion fatigue. What they found is that if you add in compassion satisfaction, it gets rid of compassion fatigue. That if you can find pleasure in your work, there's a resiliency factor with compassion fatigue. It's a mediating factor. And it transforms the negative aspects of your work into positive ones. But how do you get that, right? We all start with that, hopefully. But it really is about taking care of yourself. And so I want to talk a little bit about self-care, which I'm sure all of you have been exposed to at some point. So some of this is like, okay, I know this. But I want you to think about, as I'm going through this list, are you doing this? Is this being applied to your life right now? How are you doing on these things? Okay, so I've got 3 categories. The first is just the basics. These are things that create buffer for your life. So if you can focus on these things and have these kind of in a healthy place, then your body and your nervous system has more room to manage your emotions, because it's not worrying about, oh, I didn't get enough sleep, and so it has to use your resources to manage that. Okay, so the first is sleep. Sleep is hard, especially depending on the shift you work, the job you do, but being consistent, having good sleep hygiene, so trying to go to bed at the same time and wake up at the same time. Only using your bed for sleep and sex, right? Not reading in your bed or watching TV, only things associated with rest in your bed. If you are laying in bed for longer than 20 minutes, get up. You're only causing your brain to start associating your bed with like, oh, this is just the place I hang out and think about all my problems. So get up, move around, do something, I always say something kind of boring, but something that engages your brain a little bit. So you want to watch a show that you've watched a million times that you like still, but that you're not going to have to wonder, oh, I wonder how this ends. I have to keep awake so I can watch the ending of it. You can just fall asleep. Okay. For me, I save a bunch of episodes of Dateline, because even though they're all about murder, the voice of the narrator is just kind of soothing, and I fall asleep to him. So other people, I know you can follow, Bob Ross also has that kind of soothing voice, and so sometimes people will say, like, you just put on Bob Ross, you fall asleep. Something like that. Diet and water. If you're fueling your body with unhealthy things, you're just not going to feel great. So make sure that you're fueling your body appropriately, drinking enough water, getting all the adequate nutrition that you need. Limiting your substance use. Alcohol, marijuana, any other type of thing that can become out of balance when you're in stress. Exercise, okay? Especially outdoor exercise right now. Getting some sunshine, moving your body will help your nervous system regulate. There are several studies out that have shown that taking a short walk, especially in the morning, is just as effective as an antidepressant for mild levels of depression. Okay, so if it helps folks with mild levels of depression, it's probably going to help everybody. So it's something that will just kind of start your day off right. And that sunshine will give you the vitamin D, which will help you feel better. And then finally, create joy. Every day, you should be doing something that makes you feel better, that recharges your batteries. And that's going to be different for everybody. Okay? You, as a rule, should be paying attention to the things that make you feel better. When at the end of, if you do something and you're like, oh my gosh, that was so great, I wish I could do that all the time, that should go in your joy list. Those are the things you do on bad days. And it could be something as simple as playing with your dog. It doesn't have to be anything, this amazing outlandish, I'm going to go to Disneyland because I'm having a bad day. It could just be hanging out on your couch talking to your spouse. Then the next section I have is focus on your needs. These are a little more than just the basics. So connection and community. This can be really hard right now. I've talked to several people who really miss physical contact. They miss being able to give their friend a hug when they see them, or interact face to face, go visit their parents. Okay, but finding some way to have some connection with someone that you can feel a part of a community, you can have a conversation with someone, and you can talk about the things that you need to talk about. Okay, it's kind of your safe space. taking care of your soul. These are things like spending time alone, journaling, doing some mindfulness exercises, and breathing. Okay, breathing is one of the simplest things we can do, but it can do so much to help us in terms of regulating our nervous system. There was a study that I was looking at from 2018. It was Herrero and others. It was on breathing, and it looked at how breathing affects our nervous system. And the researchers found that quick, rapid breathing triggers our amygdala, which sets up our fight or flight system in our nervous system. So if you have this quick, rapid breathing that maybe you do when you're stressed or anxious, you're pushing yourself more and more and more and more into higher levels of stress. But if you take long, slow, intentional, deep breaths, it helps your nervous system regulate through what's called the insula. And the best way to do it is to take a big breath in and then a longer breath out. If you have a longer breath on exhale, it triggers to your brain, okay, I just need to, I'm soothing myself. I need to calm down. And it will take you out of fight or flight quicker. So, I always used to teach square breathing. So you breathe in for 4, you hold it for 4, you breathe out for 4, you hold it for 4. And you just kind of imagine a square. Now it's more of a trapezoid. So breathe in for 4, hold it for 4, breathe out for 5, hold it for 5. Okay, so that it's not quite a square anymore, but you just want a little bit longer exhale than inhale. Realistic positive talk. You want your self-talk to be, it's to be realistic and positive, but not positive in the sense that you need to be like, everything's great and everything's fine. More like, I can handle this. This is hard, but I can do it. Okay, and so paying attention to the things that you're telling yourself really does make a difference. Knowing your limits, recognizing where you are, and setting appropriate limits for yourself and boundaries for others. Okay, so limits are things like, I really can't take that extra shift, or I really want to do that thing, but I need to stay home and sleep because I'm just getting overwhelmed. Create routines. Even if you don't have a lot of routine in your day, having some consistent, predictable things can help you feel more in control. So, I've been talking with parents, over the course of these last few months. Their kids don't really have a structure because there's no real set school day. Now it's summer. But if you keep your kids on a routine, they will do better behaviorally. They need that consistency, and we as adults do as well. We just don't act out the way little kids do, most of the time. And then finally, finding gratitude and empathy. This is a really hard one. Gratitude and empathy are also areas that are kind of up-and-coming research in psychology, because the more you can find gratitude, even in the hard times, the more resiliency you have. And so even though as you're struggling with compassion fatigue, your empathy is going down, 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 working on finding empathy and working on finding gratitude will help kind of reverse that cycle. The last area of self-care is your internalized beliefs. And this actually is probably the most important, because if you are telling yourself, I can't do that, like that's selfish, I can't ask for help, people will think I'm weak, then it's going to sabotage everything you're going to try to do. You're not going to be able to pull yourself out because you're going to feel like you're stuck with this and it's not okay to be where you are. So really having some compassion for yourself, being able to ask for help, recognizing those negative patterns in your thinking about some of these things. Are you comparing yourself to others? What are your expectations for yourself, and are they realistic? So I have some resources that are included in your handout. There's a couple of websites that are excellent. CompassionFatigue.org, which I'm going to show you a slide of in a second. And then there's the Center for Physician Wellbeing also has quite a bit of information on compassion fatigue and how to combat it. There are 2 TED Talks on compassion fatigue that were pretty helpful. That might be something, if you enjoy TED Talks like I do, that would be good to watch. And then a few books, 2 of them by Charles Bigley and one by Christine Maslach, who is a social psychologist. Also some resources in terms of mental health. So suicide prevention, national domestic violence, and disaster help hotlines, because all of those things you're more at risk at during this time. So this is the Compassion Fatigue Awareness Project. The website is there. Again, it's also in that resource list. Their whole purpose is to educate and provide information about compassion fatigue. So promote awareness and understanding of compassion fatigue. They have all sorts of handouts and information on compassion fatigue, including this that I included, that you can print out. There's healthcare workers' rights, things like that will just help you recognize and combat some of the symptoms of this. Okay, and some of these are included in what we've talked about. So I also found this do's and don'ts of recovery just as a reminder. So not blaming others. Don't do anything major when you're in compassion fatigue. Don't hire a lawyer. Don't make major changes. Okay? In your handout was a little card that looks like this. This is it's from Compassion Fatigue. The author is one of the researchers from the project, but she created this card that you can print out, fold, and keep with you. And it just has some simple reminders of what you can do to help yourself when you're feeling overwhelmed. I didn't include the second part on our slides, but it's focusing on your empathy and how to become better at switching between work and off modes. So I would really encourage you to take a look at that. It's a good resource, and it's something simple that you can print out and have at your desk or have in your scrubs or your badge, something, so that it's something to refresh yourself. Okay? And then finally, this is the scale, professional quality of life scale, that should also be included in your handouts. It talks about helping and helpers, but anytime you see that word, you can kind of substitute what your specific role as a helper is. And so you look at each of these 30 questions or statements and indicate whether they happen never, rarely, sometimes, often, or very often. And I believe the version that I included with your handouts is self-scoring, so you should be able to go through and score it, and it breaks your score down into compassion fatigue, compassion satisfaction, and I think burnout or secondary trauma. So, and I just in case, I did include all those questions in your slides so that you can take a look at them. So here's my contact information again. What questions are there? What questions can I answer?
Is there a certain medical position where you see compassion fatigue higher, like for example, like physicians or nurses or?
The studies that I found seemed to indicate that nurses have the highest. It is simply because they do so much one-on-one patient care, and folks that work in emergency rooms or in like trauma centers. Anybody else?
Please feel free if you're joining us virtually, you can ask questions as well. Just remember to unmute yourself.
Okay, well,
I have another question.
yeah.
Are you seeing anything where they're, like, such as hospitals, are they doing anything to combat compassion fatigue for their employees, or anything they can do to, see the signs, but also to help be more proactive in stopping it or trying to eliminate it?
Yeah, I think having opportunities to express, to express joy, essentially, like some of the health activities that the hospital has done in the past, like walks, going for walks, having a, kind of a break in the middle of the day, things like that. When I was looking, I didn't see anything specific that hospitals are doing, but I also wasn't specifically looking for that. So I would suggest, though, like kind of looking at that self-care and, okay, how do we make sure that our, our employees of our department are able to do that? So, yeah, I don't know if that answers your question.
No, that's great. Yeah. Thank you.
Yeah.
Any other questions for Dr. Cooper at this time?
Okay. Well, if you think of one later or you just want to ask it in private, you're welcome to do that. I know sometimes people are hesitant because they don't want to expose themselves, but I'm more than happy to interact with you either way. So.
Well, thank you for joining us for our Lunch and Learn today. Stay tuned for our next Lunch and Learn next month. And thank you, Dr. Cooper, for coming and presenting today. This is a very important topic, especially right now.
Yeah, thank you.
Yes.